Today we're diving into one of the deadliest pandemics in human history, the Spanish flu. And yes, we're going to sprinkle in some humor because, well, if you don't laugh, you'll cry, right? The Spanish flu of 1918 to 1919. Sounds like a bad horror movie, right? But this wasn't your run-of-the-mill flu season. This was the granddaddy of all flu seasons, complete with plot twists and a body count that would make a zombie apocalypse blush. So, what exactly was the Spanish flu? Well, for starters, it wasn't actually Spanish. I know, right? They just got the short end of the stick because Spain was one of the few countries that reported openly about the pandemic. Thanks. During World War I, most countries involved in the war suppressed news about the flu to maintain morale. Spain, being neutral, freely reported on the flu, and voila, the name stuck. The Spanish flu was an H1N1 influenza virus, a particularly nasty one at that. It first appeared in the spring of 1918 during World War I, and it spread faster than gossip in a small town. Seriously, if gossip were this efficient, no secret would be safe. The flu came in 3 waves. The first wave was pretty mild, just a little preview. But then the second wave hit in the fall of 1918, and it was like the flu decided to hit the gym and bulk up. It was deadlier and more widespread, causing a staggering number of deaths. The second wave was responsible for most of the deaths. The virus didn't discriminate. It killed young, healthy adults, which was unusual for the flu. It's like it had a vendetta against people in their prime. Usually, the flu is most dangerous for the very young, the elderly, or those with weakened immune systems. But this virus was different. It caused a phenomenon known as a cytokine storm, where the body's immune system overreacts and attacks its own cells, leading to severe respiratory distress. In total, the Spanish flu killed an estimated 50 million people worldwide. Some estimates even go up to 100 million. To put that in context, that's like wiping out the population of Canada twice, or all of California, or, well, you get the idea. It infected about 1/3 of the world's population. That's like if 1/3 of your Facebook friends all got sick at the same time. Yikes! Now let's talk about how it spread. The primary way the Spanish flu spread was through the movement of troops during World War I. Soldiers lived in close quarters, traveled across continents, and were often in poor health, making them perfect carriers for the virus. When they returned home, they brought the flu with them like an unwanted souvenir. The virus spread quickly through droplets released when infected people coughed, sneezed, or even talked. With crowded trains, ships, and battlefields, the flu had plenty of opportunities to jump from one person to another. It was like the flu had a first-class ticket on the world's worst tour. Life during the Spanish flu was tough. People were told to wear masks, schools and theaters were closed, and public gatherings were banned. Sound familiar? And let me tell you, their masks were not the stylish face coverings we see today. It was more like strapping a cloth diaper to your face. Fashion was clearly not a priority during the pandemic. Public health officials and governments implemented various measures to control the spread of the virus. They promoted the use of masks, which led to a boom in mask wearing, though compliance varied. In some places, you could be fined for not wearing a mask. It was like the original anti-masker movement, but with more handlebar mustaches. People also tried all sorts of remedies to fend off the flu, from garlic necklaces to smoking cigarettes. Yes, you heard that right. They thought smoking would protect them. Imagine telling people today to smoke more to stay healthy. Desperate times, desperate measures, I suppose. Hospitals were overwhelmed, and many makeshift hospitals were set up to accommodate the influx of patients. Medical staff worked tirelessly, often falling ill themselves. The situation was dire, with many communities running out of coffins and having to dig mass graves. Here are some jaw-dropping facts about the Spanish flu. It killed more people in 24 weeks than HIV/AIDS killed in 24 years. It even killed more people in a single year than the Black Death killed in a century. That's some seriously grim math. Another interesting tidbit. The Spanish flu reduced the average lifespan in the United States by about 12 years in 1918. Imagine waking up one day and finding out you've just aged a decade overnight. Talk about a bad day. The pandemic also had some strange side effects. For example, some people reported temporary hair loss after recovering from the flu. So if you survived, you might have ended up with a stylish new bald look. The Spanish flu finally started to fade away in 1919, partly because people who were infected either died or developed immunity, and partly because the virus itself mutated to a less deadly form. It also helped that World War I ended, reducing the movement of troops and the spread of the virus. The virus didn't vanish completely, but became less lethal over time. In the end, humanity won, but at a huge cost. And what did we learn? Wash your hands, cover your mouth when you cough, and please, for the love of all that is good, don't smoke to avoid the flu. Thanks for joining us on this journey through one of the most devastating pandemics in history. If you enjoyed this video, give it a thumbs up, share it with your friends, and don't forget to subscribe for more fascinating and sometimes bizarre history lessons. And remember, history has a lot to teach us, even if sometimes it feels like a horror movie marathon. Stay safe, stay healthy, and see you next time.